As you prepare for surgery, there are several things that we need to keep in mind. Before surgery, it's important to remember that we need to get the medical clearance from your primary doctor clearing you for the operation. Usually this involves a basic medical exam where the doctor will do vital signs and take physical to ensure that there are no surprises on the day of surgery. Occasionally this will include blood work and an EKG, depending on where we're operating. If we're in office under local, the physical by itself will be enough. We will review the results of the medical clearance at your pre-op appointment 2 weeks before surgery, where we will also go over all the instructions, medications, follow-ups, and consents pertinent to your particular surgery. We always emphasize the importance of eliminating a blood-thinning medications prior to surgery. This includes aspirin, any over-the-counter painkillers such as Motrin, Advil, Excedrin, supplements such as fish oil, omega-3, vitamin E, multivitamins, anything that might thin the blood and increase the risk of bleeding, swelling, and bruising. If you are taking a blood thinner that is essential for your health, such as after having a stent or a stroke, we would discuss that with your primary at the pre-op appointment to ensure that they're aware that you're having surgery and that we would prefer if you could hold the blood-thinning medication prior to your case. This is not always approved by the primary or the cardiologist, and therefore we need to address that before the surgery. While it is possible to still do your surgery, we will expect there to be a little bit more bleeding, bruising, and swelling thereafter. If you are taking blood pressure medication, it is essential to take the blood pressure medication the same as you normally do on the day of your procedure in the office. We expect that your blood pressure will be elevated already just from nerves of having surgery on the day of the procedure. Therefore, take those medications the same. If you usually take them in the morning, take them the morning of surgery with water. You can also have breakfast if your procedure is in office. You do not have to be fasting on the night before surgery because we will not be having an anesthesiologist in the room and will not be even having an IV for any other anesthetics other than just local injections. We do typically prescribe Valium and sometimes hydrocodone to take in advance of surgery. That is taken here in the office. You'll have a 30-minute arrival time prior to your procedure during which we will take those medications, make sure that you feel relaxed enough to proceed. We'll check the blood pressure and then mark the eyelids appropriately for your particular surgery and then get started. During surgery, your eyes will be closed the majority of the time. You will not be watching anything done, which helps get through the procedure. We will be injecting local anesthesia, depending again on your particular case, sometimes along the upper lid, sometimes the lower lid, sometimes other areas in the face, just depending on what we're doing. But you will not have to watch these injections happen. We will do our best to make sure you're distracted and comfortable at the time of the injection, which is burned to some degree going in. But after a few seconds, it should numb very well and last for a good hour for the duration of the procedure. After the procedure, it is important to have a ride home. You will not be able to drive yourself home after taking Valium and other medications prior to surgery, as well as when we operate, sometimes the ointments we use around the eyes can get in and make it blurry. Therefore, definitely plan on having a ride, either a family, a friend, a relative, neighbor, to drive you home that day after the procedure. While we do not expect much pain afterwards, it's normal to experience a little bit of soreness, some discomfort perhaps, in the first few hours after the procedure. Usually by the evening of the surgery, patients are feeling fine, but early on, if you need to take anything, usually Tylenol is enough to minimize the discomfort. It is also not going to thin the blood and be safe to take afterwards. Again, I would avoid any blood thinners for the first 48 hours or so after surgery. The other important thing to do as soon as you get home is ice the areas operated. Usually any incision made on the upper lids, for example, after a blepharoplasty, upper or lower will be best to apply the ice to those areas or the stitches with the eyes gently closed for about 20 minutes every hour. That means 20 minutes on, 40 minutes off throughout the rest of the day, the evening. Do not need to wake up at night and do it overnight, but resume again the next morning, and continue the next day. And then we can taper off on the third day of icing. It is also important to keep the head elevated. You want to avoid bending, straining, lifting, anything that brings a lot of blood flow to the head for at least 2 weeks after surgery. Walking is perfectly fine with sunglasses. If you're going to be out and about, wear the sunglasses, avoid the sun exposure to the areas operated or to the lasered areas, and try to keep the head elevated. Walking will be perfectly fine to pursue and continue in the immediate aftermath of the surgery. I would sleep with the head of the bed elevated on your back about 30 degrees facing the ceiling. I would do this for the first 10 to 14 days after surgery, depending on what we do, to help eliminate the accumulation of swelling and excessive bruising around the eyes. Avoid direct water pressure and heat to the face. So I wouldn't shower for at least 48 hours after surgery. And when you do, carefully washing the hair from the back is best. You do not want to stand directly in the shower with the water splashing on your face. Pressure, water vapor, and heat do not help the healing and only make it more likely for the stitches to come loose. It is essential that you do not rub your eyes after surgery. Do not scratch them. Do not pull on the areas around the stitches, as this can cause the stitches, which are very thin in nature and very delicate, to open up. This would mean that we would need to come back into the office and close it up if that should occur. It's very rare, but we want to prevent that by avoiding rubbing, scratching, or any other products on the face while it's healing. We will have a follow-up appointment 1 week after surgery where we will take out stitches, check on the healing, and if there are any concerns before the patients can feel free to call me at the office number. I can be reached after hours and on the weekend. All calls come directly to me. I will reach out soon after surgery to make sure you're doing well, but that's how we know that, generally speaking, after these procedures, patients feel fine by that evening. There is a consent form to fill out at your pre-op appointment. On that consent form will be many things that don't generally happen. So just because you see it on the form does not mean that this is a common occurrence for us at all. It may have never happened before. The latter 3/4 or so of that consent really hasn't happened. Things that I would expect, for example, include a little bit of hyperpigmentation along the incision lines. Initially, that incision line can be a little raised, it can be a little red, it can get a little hyperpigmented. It can take months to heal in terms of the incision line, which is generally very hidden in the eyelid crease, or just getting inside the lid if we're doing the lower eyelids. So there's no incisional scar at all on the lowers typically, unless we have to do a little bit of a skin tightening procedure or a skin pinch. Dry eye can also be something that patients experience afterwards. Depending on how heavy the upper lids are and how much of a lift is necessary, that can dry out the eyes. Patients may need to use some more artificial tears while they're recovering in the first few weeks, generally, or longer, potentially. But for most patients, it's really not a lingering issue. Patients with pre-existing dry eye should be aware that an upper lid procedure is going to dry out the eyes more so than before. But this is something we can discuss in your particular case. While it's normal to experience a little bit of oozing from the incision lines after surgery, it shouldn't be a persistent issue. It should last maybe the first 24 hours. If you notice a little trickle from the incision line or a little pinkish tear after surgery, that's expected. But it shouldn't be brisk, and there should be no hematoma forming anywhere around the eye. If you feel pressure, pain, discomfort, tightness of the skin, or any other concerns, don't hesitate to reach out to me. You call our office number 714-449-1940, and I will be able to get that call immediately.